Rodney, we treat a lot of the same cases, respiratory cases on the racetrack in my case, and a lot of them are, treated successfully and we don't worry about them. When they become unresponsive, when I think I'm in trouble, I refer them to you. A lot of those cases turn up to be pneumonia cases. What do you do once that case arrives at your hospital?
Yeah. So, typically evaluating the SA is a pretty integral part of my initial workup. And in ultimately diagnosing them with bacterial pneumonia, that comes down to the history and then also my findings on ultrasound. So I usually establish a baseline on ultrasound, see what the lungs look like, and then also establish a baseline in my SA as well. So I have a number going forward, that I can, go back to. One case in particular that was actually referred by your practice, this was a horse where the SA had plateaued in about, the 1500 range, and was referred in for additional diagnostics, and
like what? Like
yeah,
the ultrasound?
Ultrasound, transtracheal wash.
Right.
So we wanted to determine, what the the etiology or the cause of the infection was.
Right.
So, in this case in particular, while we were waiting for the results of the tracheal wash to come back, we had our baseline SA established. I was monitoring it daily, which would be part of my standard protocol in most of these cases, and monitor the SA daily, at least until it gets to a peak. And then, once the SA starts declining, then I'll space out my evaluations. So in this case, we were monitoring the SA daily. Day 2, we had a pretty significant spike, up to 3,000.
So what does that mean? I mean, is it the disease spreading? Is it another disease popping
Well, yeah,
up?
it could mean one of two things. It could mean an acute exacerbation of the initial disease process, and in this case, a pneumonia progressing from a straightforward bacterial pneumonia into a bacterial pleuropneumonia where it develops fluid in the chest. Or it could mean that there's another disease process that's, starting to manifest itself. And the big concern would be colitis, especially for a horse that's been on antibiotics for a long period of time. So yes, that sort of a spike can indicate one of two things.
And you use your diagnostics again to...
Yeah, so in a case like that, with a spike, if I suspect that it's gastrointestinal related, then I'll obviously ultrasound the abdomen. If I think that it's an exacerbation of the pneumonia that we've been treating, reevaluate the chest. And then in this case, 24 hours later, that spike in SA actually preceded development of fluid in the chest, and so
So it was predictive.
It was very predictive
of the disease spreading.
Yes.
Wow.
Yes.
That's
and then thankfully we're able to get in early and drain the chest and address that acute exacerbation a lot sooner. So
I'm glad we referred it.
yeah.
That's really neat. So. The way you treat any pneumonia is the same way. If you see a normal plateau and drop, it's okay. If something out of the ordinary happens, you chase it down with everything else we've got in our arsenal.
Yeah, and I'll typically, again, once the SA's, on a downward trend, we'll start monitoring it maybe every 4 or 5 days, as long as I'm happy that things are going well clinically and the SA is continuing to come down. One thing that I'll say with these cases is that, the SA drops so precipitously with the appropriate course of treatment that I usually tend to treat beyond normalization of the SA. I'll still have horses where the SA is normal, but I can still see pathology on the ultrasound. So because the SA drops so quickly, I usually tend to treat these pneumonia cases beyond normalization of the SA.
If you don't, do you think it comes back?
Could potentially. I don't want to take that chance.
Yeah.
So,
Okay, great.
Yeah.
That's awesome. Thank you very much.
Yeah.
Thanks.
Thanks. Thanks.